So record the session. Hello, Enrique. Thank you. Welcome, everyone. It's always lovely to see familiar faces, and it's also wonderful to see new people with us today. I'm Dr. Deetra Hawkins. I have a few team members here and people who have worked with me in the past. So wave, say hello. Honey Sanchez, Caddy's worked with me before. Let's see, I have Tawana Marlisa's worked with me before. It's so good to see y'all. Yes, I know. And for new people, welcome. We are always excited to see you. Today, our conversation is on health equity. Oh, listen to that. Okay, Cindy, you've got a little rain here where you're zooming in from. So one of the things we like to invite you all to do is say, where are you zooming in? Where are you joining us from? All right, we got Hartford, Connecticut, Maryland, Middletown, Connecticut. Okay, I saw something in Minnesota I don't think I've seen before. All right. This is Jerome, Arizona. Atlanta. Yay, Atlanta people. All right. Portland, Connecticut. Love it. All right, we're zooming in from all over Minnesota. Yes. I don't know. This is a good song to be playing before tomorrow, Juneteenth, right? All right, yeah. No way, we have some friends on. I love it. That's so fun. Okay. Well, welcome everyone. This is our June webinar. We're talking about health equity, and we're just so excited that you are here with us and joining. I want you to see everyone, sort of, if you are able to look at the gallery view, if you're able to come on Zoom, it's nice to just like wave and say hello. One of the things I love about these webinars is just seeing the interest, both in people who register and those of you who show up, and then those of you who will watch the recording later. I think it's helpful to see that we're not alone in this process of wanting to do things differently, improve on the health and wellness of our country and other places, and just being a community together. So one of the things that COVID has at least gifted us with, if we want to see it from a positive perspective, is our comfort with Zoom these days, being able to have communities gather together from all over the country, all over the world, and have connections and make connections with each other. So this hour tends to go very quickly. I'm going to go ahead and share my slides. So hopefully you can see those as they have come up. And while we are still gathering, I'd like to invite you in the chat. What is something you recommend for self-care? It could be something you do, could be something you know you should be doing that you're not doing. But what is something that you recommend for self-care? Okay, I see some great ones. Taking time for yourself, dancing, yes, walking. Oh my gosh, yes, pets can be so helpful. Beautiful, set boundaries. Oh my gosh, yes, set boundaries. Breathing. Okay, there we go. I don't know how many of you practice box breathing, but I know it's one of the things we like to talk about. Yoga and meditation, absolutely. Quiet time, right? Prayer or meditation, beautiful. Oh, yes, time in the water, time with plants, just doing things that you enjoy, paying attention to what you do enjoy. I think that's important. Sleeping, I always mention the nap ministry and how important that is. Getting away from the hustle and grind, finding things that work for you. Yeah, being able to say no. And some other work we do. And if you all are getting our newsletter, I talked about letting go, right? Let go or be dragged as a theme for this year. Oh yes, doing gratitude, starting off with some gratitude. Beautiful, beautiful. One of the things that we try to do is share ideas with each other. One of my go-to strategies is to read funny books, lighthearted books that are not, too heavy. And actually, books like children's books are some of my favorite to get into. One, because I used to do a lot of work with kids, but also because there's a lot of beautiful lessons there. So just to share some pieces. So welcome. Thank you for getting us started. I titled this session Health Equity and in terms of our webinar of being responsive instead of reactive. And I wanted to speak to that for just a moment. One of the things that I am very aware of in our culture is this tendency to really be reactive and like sort of prioritize the idea that we need to always be in action. And I want to encourage us that there has to be a balance between that being responsive part, which is more intentionality, and being reactive. So really understanding that we have some intentionality in how we respond to things, and then being and noticing when we have a reaction that we're able to be intentional about how we want to respond. So that's a huge part of this work, and especially when we start to think about what is health equity, and some of the focus of that in our country right now. So to just go over what I hope we'll cover today is the importance of health equity. We've already actually, right, started to discover together what are some things that we can do to enhance our health and wellness. We'll talk a little bit more about that today. And then one of the areas that I find that a lot of communities may not be um, attentive to is that we're often, I don't know, raise your hand if you've heard of being trauma informed. All right. 1, 2, 3, 4, 5, 6, 7, 8. Yeah, I mean, we've heard of being trauma informed. And what I want to encourage us to recognize is that it is important to be both trauma informed and responsive. Okay, we have to go beyond just that first awareness phase of things and actually move into an understanding and a way of using that awareness, that information to help us heal, and actually develop processes for how we can support people's health and wellness. So one of the ways that we do that, and I know I have at least one of my team members that's on with me. So I'll invite Tony if he is interested in sharing. We always start with our basic tenets. So is there any tenet here today, Tony, that is standing out to you?
Um, Absolutely, Deetra, and thank you for the opportunity. The one that stands out for me is that this work is messy and some toes will be trampled. You know what I'm saying? Like, and the reason that, like, a lot of times in the spaces, and especially in the last couple of weeks that I've been in, there's been some, I don't know, I just it's been messy, and the tendency for me is to then fall back and shut it down when I really need to stay present and 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 listen with intent to understand.
Mm,
So yes,
Thank you. Thank
you're
you.
welcome.
So for people who don't know us and the work, we always start off, I think, to underscore the idea of being not just trauma informed, but also trauma responsive. And in sharing our basic tenets, like how are we coming to this work? And so one of the reasons that I do this and I take the time to do this is that we don't always practice our own transparency when we're inviting people to be vulnerable with us. Okay. And so this is one of the ways that we try to start off with this is just acknowledging that part. And so I invite you to think of your own basic tenets that you might use when you're working with people or going into communities, and especially communities that have had well, all of our communities at this point have been traumatized. So I would just say anybody. And part of that is to say, right, that everything we do has a context. And so the way we show up here, the way that we enter into an organization, a community, the way we talk with someone, there's something contextual about why we're there. And more often than not, most people, when they see me, for example, they think there's a problem that we're here. And what I want people to know is that we really come into every organization, every person we meet with first the frame of wanting to know what's making a difference in their lives, what's helping them, what is what has been working for them in some way. And as you'll hear with us, sometimes it's important that people may not answer that question, but it's important that we ask that question. Okay. So I want to just leave that with you as also a tip for how we do this work. The other side of the of all of this is recognizing that most of us are often looking for an answer right away, right? And so there's this pull to have a cookbook approach. There's a pull for someone to say, tell me how to do it, right? And what we want to acknowledge is that that pull is completely understandable, and yet it is also one of the things that can get us stuck if we stay there. So we want to encourage us to, one, recognize that we all have different roles that we need to be able to play, and that those roles are all important. And that when we create or we go in looking for the blame, the answer, the solution, sometimes we're actually eliminating the possibilities of there being multiple solutions. So as we do this work, I really want you to know that our approach here is not to try and find a place to create blame, but to actually open things up so that we can see multiple pathways forward instead of just one way, and that we're also going to work with the way our brains want to work, which is they want closure. So we have to find a way to sit with that tension. So I'm going to do a little quiz with you, and we're going to see if our polls here want to work. We have had a regular use of so tell me, can you see the poll questions here? Yes, there we go. All right, so this is what we like to start with. Have you downloaded our small group guide? Have you used the guide if you have downloaded it? Have you participated in our race equity cohort? Have you attended a dinner, either Drexel, Cleveland, Chicago, health dinner, also very many. And currently, are you a member of any of these? And this is multiple choice. And are you excited to be here? Okay, we're gonna give you a couple minutes. We're about 50% there in terms of everyone has answered the quiz, the poll here. And love to see, Tony, are people adding in the chat where they are also, what groups they're part of?
They are, yes. Would you like me to read some of them? Or?
Yeah, I mean, so I know y'all are answering the poll, but it's almost 40% of you are from some other type of group. So if you would let us know what you're a member of, that would be lovely. And I'm also going to, I'm going to end the poll and share the results. Here we go. So Oh my gosh, still a good number of you are saying, what guide? Okay, so on our website, there's a place you can download a small group guide. And that is a tool that we make free for you to use if you are in a position of trying to lead conversations. It's got great tips and strategies within it. So we just want you to know that that is something that is available. And then maybe you'll send us a message and let us know that you have used it, not only downloaded it, but also used it. A good number of you have not participated in our cohort yet. So I hope that you will look for an opportunity to join that with us. And some of you have done a dinner. So that is super exciting, especially since 30% have done mini dinners. One person has done one, and then a good number of you haven't at all. So look for some opportunities. We will be sending out information about an equity dinner. We also, I can tell you right now, if you want to put on your calendar, July 17th from 6:30 Eastern time will be an opportunity. So hold that date for an opportunity to do a dinner. And then, yeah, we have some people who are absolutely excited to be here, and some of you who are, yeah, I'm excited. That's good. Great. Tony, who all do we have extra here? Like from other
Awesome.
groups?
Yeah, so we have Cindy Dugan from the Presbyterians Race Action Network. Ann is here from our Ann from both Ann partners. Hero Ortiz, freelance advocate, right? Hero, I may want to ask a couple more questions after, okay? Just want you to know. We have Kelly Edwards, Connecticut Department of Mental Health and Addictions Prevention Division and DEI training facilitator. Got my good friend Cherie Bragg from Yale from the PERCH program for recovery community health. We have 14 colleagues. Well, Joanne is here with 14 colleagues from Park Pride. We have Lisa from the Department of Mental Health and Addiction Services in Middletown, Connecticut. We got Taylor Parker. How do you pronounce your first name? I don't want to say Gilia.
You got it right.
Director of Community. I'm sorry. Go ahead. Say it again.
You got it right. It's Gilia.
All right. Awesome. Director of Community Engagement and Diversity for Atlanta Realtors. Marlissa Nixon from Aspire DBHDD Services, DEI lead and facilitator, recovery champion from Albany, Georgia. Enrique Sierra, Department of Mental Health and Addiction Services from Connecticut. Yeah, and that's all. Well, let me see.
Excellent.
Yeah, that's all I can get right now.
I think we got most everyone. So we're always curious on who's here. Oh yeah, it looks like we've got another person also with the Department of Mental Health Addiction Services.
Yeah, Tara Hall. Yes.
All right. Welcome. Well, couple things as we're doing this. So I'm curious in chat for you to share some responses. So what percent of people would you say who wind up in the public health system have been part of oh my gosh, what am I trying to say? Have been exposed to a traumatic event. And y'all, just so you know, my computer just told me that I have a low battery. So I'm going to partly see if I can also join on an iPad. Isn't that fun? This is going to be fun. Okay. So what percentage? 80, 90, 100, 70%? And while you're doing that as well, okay, yeah, so 80, 90%, 80, 90%, okay, 70%, yeah, 90%. So yeah, the answer has been between 80 and 90%. And of course, that is going up now. Love what are some of your other thoughts for these questions? So equity is, love for you to add what you would say equity is. And true, false. Are we experiencing a loneliness epidemic? Wonderful. Let's see how I make this. Okay. So team, can someone pull up the slides maybe that we're using, and I will join on my iPad for the rest of the session. And then I'm excited to see everybody answering the questions already though. Okay, so I'm going to stop sharing here and shift the.
Do you need me to share, Dr. D?
Yes, please.
Wait a minute. Slide.
All right, everyone. Thank you for your that was fun. I'm like, oh my gosh, power going out. What's going on? Oh, and I see, Joanna, now that I can see that there are multiple people in one. Oh my gosh. Hello, everybody. Well, I love this. So I guess there are probably multiple people who are answering this question of whether or not it was 70, 80%, what's going on there. Wonderful. So I think I can tell from the answers already that a good number of you are wondering about how to explore, understand what's going on, and you're curious about this topic. Yes, understanding racism as a public health crisis. And one of the things that I think is important about this work is knowing that there are cities that have begun to actually declare racism as a public health issue. And our CDC has helped us have a better understanding of what we mean by that. So Tony, we'll go to the next slide. So if you're not aware, the World Health Organization has also helped us understand the importance of health equity, and noting that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I think it's important for us that we are asking the question, why does health matter? And that ultimately health is about wealth, right? So it's very hard to be active in our society and culture if you are not well. And when we start to look at some of the things that actually get in the way for people, it is often a health issue that gets started. So being healthy enables us to live a life that's fullest and to do things that we love. We'll go to the next slide. Many of us have seen the first two pictures here, right? Equality and equity. And understanding that there is a difference between equality and equity. And we also want to talk about the importance of justice. So eliminating barriers. We'll get in the next slide. And that as we are doing this work and thinking about this work, we want to focus on health equity being a state in which everyone has that fair and just. So thinking about justice, opportunity to attain their highest level of health. And so the question is, well, what if? Like, what if we actually address the root issues? What if we understood health as a system issue and not just a personal issue? And where might we go if we can explore these topics a little bit more? We'll go to the next slide. So one of the ways that we need to do that is we have to be willing to explore the historical and contemporary issues, and we have to explore opportunities to overcome economic, social, and other barriers to health and healthcare. We'll go to the next slide. So I want to, and Tony, we'll see how well this works. This is a couple pieces here, everybody. So one is we are recognizing that we can eliminate preventable health disparities. Two, we can find ways to heal racism. So if you are a part of any of the work that we do, we're always talking about ways to do that. Three, it's important to explore what do we mean by intersectionality. So when you get a chance, you can take your phone, scan this little QR piece here and take an intersectional quiz. And while you're trying to pull that up, we are going to see if our technology is going to work. Tony, if you click on systems thinking, we're going to hear a story about how important, I'm saying stories, systems thinking, how important using motivational interviewing can be in supporting a person's health and wellness. I think we need to share the sound.
In the Environmental Health Division within the local health department in Key County. And I was assigned to work with a health investigator who was dealing with cases that had residents who had a difficult time meeting local code around the rodent control code. The problem was that they would have these cases where none of the steps would work. And some cases would be open for up to 3 to 4, even 5 years. And so they wanted to try a different approach. So they assigned me to one of those cases. And so I come from a social work background, and so I was looking at the residents' behavior from a slightly different perspective than the health educator. Motivational interviewing is a technique that draws from clients intuitive reasons as to what's going on inside them that's impacting their behavior. So through this process, I was able to learn this elderly man, he was an elderly man, his story. And his story was that he was an ex-vet, and he moved into this house when his parents passed away. And previous to that, he lived in the woods. He lived in the woods and he lived alone. And he shared with me that he had developed a really strong relationship with nature, and particularly with birds. So when he came over here to the city, he continued this practice of feeding birds, and it was a very important thing for him. And I could tell that it was something that was emotionally meaningful to him, right? And so the investigator, right, was that was the behavior that he was trying to change, because when he feeds the birds, it creates food for rodents to come and eat. So he was telling this elderly man, you need to stop feeding the birds, without understanding that for this elderly man, this was a very important emotional need that he had. More important than meeting some code that he doesn't necessarily care about. One way in motivational interviewing that we get to that place is by highlighting contradictions in people's behavior and asking them to reflect on that. So one of the problems with the rodents is that they were eating the vegetable garden. And that vegetable garden was really important to him also because his parents put that vegetable garden together. He had really fond memories of that, but the rodents were destroying it. So one conversation I shared with him, okay, so on the one hand, it's really important for you to feed the birds because that's something that you care about, and at the same time, feeding the birds creates food for rats then to destroy your garden. What should we do? What do you think? And on his own, he was like, well, maybe I could feed the birds differently so that the food's not left there afterwards, and maybe I can get a bird feeder. That solution felt better for him, right? And it was a partnership. We worked together to get to the solution. So, this had been going on for 3 years. After implementing this process, he actually changed his behavior and fed the birds through a bird feeder, and the issue was resolved. And so this was a good example of acknowledging people's stories, and that's a key component of trauma-informed approach, is asking why. What's your history? What happened? And acknowledging that really helps people feel heard, and it opens them up to work with you to find a solution.
Okay, so what'd you think of that? Love to see in chat what you thought.
Hollywood is crazy. First they had The Mexican with Brad Pitt, and now they've got The Last Samurai with Tom Cruise. Well, I've written the film. Maybe they'll put.
I'm assuming everybody is talking. Okay, there we go. Hearing stories, people sharing stories, so very important. Asking what happened, absolutely. And you would think it's so common sense, and yet, right, the other person wanted to just tell them what to do instead of engaging with the individual, right, and finding a solution, finding ways to be curious, absolutely. Safe spaces for people to talk about what's important to them, yep, and where it might be harder, that's great. What else? So I'll say one thing that, and one of the reasons I like to bring this up is that I think that often in our spaces, I will hear from people who say, why are we learning how to ask questions? Like, why is that so important? And yet, when it comes down to it, learning how to ask those questions and be curious is part of what started to elicit that story, and not just getting one part, right? Going deeper with that as well. So as we continue to do this work and as you continue to practice, I want you to just pay attention to that part. So we'll go to the next slide. Tony. As always, another strategy is to breathe. So I'm going to invite us now to just practice doing a deep breath together. We'll take a deep breath in. You should hold it. And you should let it out. That was actually good. Let's do it one more time. Take a deep breath in. And hold it. And let it out. Okay. We're going to go to the next slide. Thank you all for that, by the way. So we're talking about health equity, and this is definitely a longer conversation and process, but I thought it was important to just get us started. And that when we are exploring health equity, one of the things we want to pay attention to are these 7 overarching principles, right? And so at the foundation is really understanding that equity is at the, as at the root. We have to understand that we're talking about giving people individually what they need instead of making sure that everybody has the same thing. The second piece here that is talked about is understanding the role of embodying being anti-racist or anti-oppressive. And what I would offer is how we're actually moving in the direction of healing and restoration. Okay. So if we look at the practices of being anti-racist, which we will give a little piece in just a moment from Dr. Kamara Jones, there's an importance about being able to just recognize that like power and control are things that we really have to navigate and be understanding of, and that we have to pay attention to everybody's health. Like you having access to health and wellness has an impact on us as well, on me, that it's not an isolated thing. And that as we look at public health, or like the story we just heard, this guy is just trying to help feed the birds, right? And yet there's like this compounding impact, but then helping him think of different strategies to still meet that goal and make it so that it's not having unintended consequences is something that we can all be part of. And then, so we can go through more of these, but the one in the middle that I have highlighted is communicating effectively. And a strategy that I wanted to make sure I mentioned, and if anyone here was able to download the tip sheet, and maybe Twana, you could add it into the chat for everybody. We mentioned a strategy. One is using an appreciative approach, which is asking 3 questions. What's helping, what's making a difference, what is continuing to give you hope. And also that we can practice listening and believing people, right? And really taking time in our work to explore the role of stories. Okay, so I know you might not have been able to get it from LinkedIn. Not everybody's on LinkedIn, but the tip sheet is now in the chat. So we're going to go to the next slide, and I just to unpack from Dr. Kamara Jones these 4 principles of being anti-racist. So 1, we understand that equity. Going back, equity is important. 2, we want to understand how we can be anti-racist. And as she helps to define, there's 4 things that we should be paying attention to. That first, that racism is real, and that when we're denying of racism, that in itself is part of racism. That racism is about the system with power and control at the roots. And when we explore what we mean by that, it's understanding that we should be striving toward partnership power and power with, and the understanding of self-determination instead of fear and control and compliance, okay? And that when we think about racism, it does sap the energy of all, and that all of us are impacted by racism. And I think more and more, it's very clear that our healthcare systems, whether or not we think about providing health to everyone, for example, has an impact on all of us when we are not exploring those opportunities and making sure, for example, that our research is looking at like all people, not just often young white men, that we are doing our research on all different groups of people and talking about what those intersections are. And the last thing that I think is important in Dr. Jones' principles of being anti-racist is understanding that we do have the ability to dismantle and heal racism. Okay, we'll go to the next piece. And I think at this point, yes, so this is my favorite part, and I hope that you all will lean into this. We're going to do a quick breakout. And we want to invite you to think about, especially in this idea of health equity, what has helped you come back from something difficult? The goal in sharing this conversation, and we try to have 3 people in a room. We'll give you about 7 minutes, and we'll be like right on time for our closing out the session. is that I want you to practice sharing a story. Two, I want you to think about the things that actually helped you in coming back from something difficult. And so one of the things that I try to do, and someone's going to let me know if we have the rooms ready and where we're at, I'll get a thumbs up or something. I'm trying to look and see if anybody's like telling me if we're good or not. So we want 3 people in a room. And as we're waiting on that, I just wanted to share a quick story. So I have had to have 5 surgeries, all within a year and a half of each other. So over a period of 10 years. And one of the things that I learned in my process of overcoming or kind of healing from that process was one that I actually knew what was going on, right, with my body, and that I needed to be believed, and that the first surgery might not have happened if I had been more confident in talking with my doctors about what I knew was actually happening. So when I think about what helped me though, and just sharing that piece, it was being with others and doing this work in the recovery movement that helped me to remember and to own my own story and to seek other stories of what helps to actually heal. Because the other part of it that I've learned is that it's the healing after that was more important than the actual surgeries and the process itself of kind of getting there. So I think the rooms are ready. We should have we want 7 minutes for the conversation. If you have short hair, will you please go first in your breakout room? And I know some people might need to one of our breakout rooms because they've got a bunch of people in one room. I guess you all might need to just talk with each other and not be in a breakout.